Hi everyone, I am Dr. Andi. It is time for today's Facebook Live, always my favorite day of the week. While we give all of you an opportunity to join us, I'll give you a brief introduction into who I am and a little bit about my background. I'm a naturopathic physician. I have been practicing in Toronto, Canada for about 12 years now. I have been an educational specialist with Prove It from the very beginning. I was super excited. If you're not attending, hopefully you're all going to the Virtual Keto Academy next week. I've been at every Prove It event since the very first one, our first sort of smaller event in San Diego. It's been really incredible to watch the community grow and really to watch how invested all of you are in learning. So I was super excited to contribute this year. So I will be talking about the microbiome and how ketones and intermittent fasting and MCT oil can contribute to the health and change of our microbiome in general. So hopefully I will see you all, hopefully you'll all be able to attend. And obviously I can't wait till our first in-person event, which will be coming up this year as well. So my background, I initially focused more so on sports medicine in practice. Initially, I was a personal trainer, I was a dancer. I got very much into martial arts and did some jiu-jitsu and Muay Thai. And then slowly transitioned more into metabolic nutrition, hormonal balance. So my practice is very much focused on the hormonal balance for men and women, fat loss, weight loss, anti-aging, longevity, and regenerative medicine, and then also a component of cognitive health, preventing and reversing Alzheimer's and cognitive decline. Our stance and our approach to that in our clinic is always using the low-carb keto standpoint. That really is a foundation for our treatment. So as I was mentioning earlier, I'm talking about the microbiome. I get a lot of questions about, ketones, ketogenic diet with respect to things like IBS or Crohn's, colitis, and if there's any benefit there. So again, there are other interventions that I'd often use in practice, but there is great benefit, and that's something that I always use as a foundation of treatment. So we touch a lot on that. And I mentioned also that 40% of adults at this point have some kind of gut issue. So whether that's bloating or IBS or whatever the case might be. So I touch a lot on that. So hopefully you'll be able to attend to hear and learn a little bit more about that. But on the note about gut, I'm going to start today answering a question I actually had by a patient today in practice who was mentioning inability to digest fats. I always get questions about gallbladder. Can I eat fats? What about MCT oil? If I have gallbladder issues, I'm not able to digest fats. So that's actually a discussion I had earlier this morning with the patients. I thought I would start with that since we're on the topic of microbiome and gut health. So if you don't have a gallbladder, you have no problems taking exogenous ketones. That's not an issue. You shouldn't have any problem at all. You also shouldn't have any issue with MCT oil. That specific fat not required. The gallbladder is not really required to break that down. The issue you will have though is digesting other fats. So if you're leaning more towards a high fat, low carb diet, you might find a little bit more of a challenge there. You might find some gut issues as well. So generally for those individuals, I do recommend supplementing with a product called Ox Bile. I always get asked how to spell that. So it's OX and then bile, B-I-L-E. Supplementing with Ox Bile, and that will help your body to break down and digest fat. So I never recommend that my patients follow a low-fat diet. The low-fat, no-fat trend is gone. We know that fats are essential for health, not only of our gut, but for hormonal balance. Every cell in our body is made with fat, so getting fats in our diet is essential to our overall health. So if somebody doesn't have a gallbladder, my suggestion is never to stop eating fat, is to do things to allow you to break down and digest fats a little bit better. So again, no issue with taking exogenous ketones, no issue with the 143 or with MCT oil, but adding in, if you're following a higher fat diet or even just a lower diet to allow you to break down things like oils, olive oils, then you do need to add in some Ox Bile, and that will help you to break down those fats. Okay, so let's get started answering your questions. Hi, everybody. So question, am I Italian? Yes, I'm half Italian. Anna Maria, so yes, I am half Italian. My other half is actually Jamaican, so I'm mixed. So questions about Ox Bile, spelled O-X and then B-I-L-E. I get questions on that every time. So Ox Bile is what you need to be able to break down fats and digest fats if you don't have a gallbladder. And then lots of other questions also focusing on if you have IBS, Crohn's, colitis, is there benefit there as well? I always say that IBS, there's always a cause or a root to IBS. So I get a lot of questions, you know, people will say I have IBS and that's it, but there's usually always something underlying IBS, whether it's celiac or, you know, food sensitivities or SIBO or something like that. There usually is something underlying, with inflammation being a primary contributor and leaky gut being a primary contributor as well. So those are things that you will have to manage. MCT oil is also very helpful for healing that gut lining, and fasting being one of the sort of most effective ways, easiest strategies that I implement sort of right off the bat when anyone has some kind of functional gastrointestinal issue. Can I take MCT oil if I have high cholesterol, level of 7.3? So obviously if you have any medical condition, you have to talk to your healthcare provider. But yes, my high cholesterol patients, I'm always putting on higher fat, lower carb diets. We will often see fluctuations in cholesterol. So we'll often see an increase in cholesterol, and then it'll kind of plateau and then come down. So if you've just transitioned to a higher fat diet, I would wait about 6 months before testing your cholesterol again, because you probably will see it go up, it'll plateau and then come back down. But for my patients who already have high cholesterol, yes, I am still having them follow a higher fat, low carb diet. We will sometimes do genetic testing just to make sure that genetically they're still able to digest all those fats as well, because obviously everybody is different. And so you want to make sure that what you're doing is good for your, works for your genetics and for your body type as well. So often, sometimes we'll run some genetic testing just to make sure that is safe for them. So how do I take the ox bile? Ox bile, you can just take it once a day. Some people will take it right before a meal, but oftentimes you can just take it once a day, and that's all you need. Is it normal to have watery bowel movements for at least 3 weeks drinking ketones and doing intermittent fasting? So yes, that is normal, that the bowels will change. My suggestion would be to just sort of lower your serving of ketones right now. Decrease your serving a little bit, maybe half a sachet, maybe half a sachet or even a quarter of a sachet, and then slowly work up to a full serving. What type brand of ox bile do you suggest? So there are a lot of companies that make ox bile. I'm not sure if I'm able to recommend ones for you, but the two that I use one by a company called NFH. I use another by a company called Designs for Health. And I use their digestzymes and I use their ox bile. So those are the two that I use for my patients, just depending on what the goals are. But again, obviously you have to figure out what is underlying, if there are other things that need to be addressed there as well. So hopefully that helps. Why do I feel bloated off and on when drinking ketones? So essentially what you need to do is just decrease or lower your serving or your dose of ketones. So again, if you're feeling a little bit bloated, decrease to half a serving or half a sachet, and then slowly work your way up. Again, we are making changes to the microbiome. We are making changes to the microbiome, and sometimes when we're making changes to that gut bacteria, we can experience a little bit of bloating. So sometimes, for example, people will say that they've started a probiotic and then they experience a little bit of bloating with the probiotic. Sometimes that's normal, but again, you can decrease your dose and decrease your serving, and then slowly go from there. The only ox bile we can find is in a gallbladder supplement. Is ox bile sold on its own? Yes, it is absolutely sold on its own, or it's often mixed into digestive enzymes. So how much caffeine is in a serving? Because 400 milligrams is the max in a day. That's true. 400 milligrams is is generally the recommended maximum amount of caffeine you want to consume in a day. But in one serving, we have about the equivalent of a cup of coffee. So you should be fine. I'll drink a serving, I'll still drink a cup of coffee in a day. And then if needed, I'll just switch to decaf, which isn't an issue as well. Lots of ox bile questions today. I think we have a lot of people with gallbladder and digestive issues. Again, 40%. Is ox bile good to take for the average person? I do have my gallbladder. If you have your gallbladder, it's not really necessary. But if you are having digestive issues, there are probably other things that you need to do to help with your digestion. Again, it does help a fair bit with digestion. We can still have gallbladder issues even if we have a gallbladder. So people who have gallstones, and even before you have sort of gallbladder issues that you can see on sort of an ultrasound or anything like that, people will develop things like diarrhea, just difficulty digesting fats, changes in the color of stool, like gray, green, orange, pale. Those are all signs that your gallbladder could use a little bit of a support, and so the ox bile would be helpful for you there as well. Is a Signal OS good to take daily or just when fasting? You can absolutely take that daily. It's great to take. You can take that every day. It's not just for when you're fasting. So please feel free to add that into your regular routine. How does eating keto help us lose weight? Okay, that's a big question for sure. So the biggest thing is I've always been a proponent of the quality of your food versus the quantity of your foods. That's the first thing. A lot of the sort of higher starchier foods are very inflammatory. And so when we look at the things that impede or inhibit our ability to lose weight, it's inflammation, hormones, thyroid imbalances, stress. Those are all things that can impede our ability to lose weight. And so when we switch to a lower carb, higher fat diet, we're optimizing our body's ability to burn fat as its primary source of fuel. And so studies are showing when we compare a low fat, high carb diet, calorie restricted diet versus keto diet, that we see greater fat loss on a ketogenic diet and greater fat loss, or greater loss of visceral fat, which is that fat that surrounds your organs. It's not just underlying your skin. So it's the visceral fat as well that we're seeing a decrease in, and then we're seeing improvements in blood pressure, in cholesterol. So a lot of great research showing the benefit of the ketogenic diet versus just caloric restriction or a low fat, high carb diet. But again, the primary benefit is the quality of the foods in keto, unless you're doing dirty keto, which is the bacon and cream all day long. I don't generally recommend that for my patients, but you will still lose weight when you do that. But that's not generally how I'm recommending my patients to do it. But essentially, we're having our body burn fat as its primary fuel source to accelerate and assist in our fat loss. And then I'd love to pair that with fasting. Do ketones increase blood pressure? So no, they shouldn't increase blood pressure. But again, if you have high blood pressure, work with your healthcare provider and make sure they say that that's safe for you. What foods or drinks shouldn't be used in when you're fasting or rebooting? So really a better question is what should you have during a fast or the reboot, because essentially you're in a fasting window, so we're really limiting. We don't want to consume any foods in general. What we specifically want to avoid are sugars. Sugars will trigger insulin. Insulin will shut off autophagy, which is what we're trying to turn on in that fasting window. So in the fasting window, you can have coffee without sugar. You can have water, you can have tea. I'll allow my patients to have broth, a little bit of broth. I'll let them have their ketones and MCT oil. And then of course supplements. So the electrolytes and any other supplements that you're taking or any medications that you're taking as well. So that's usually what I'm allowing my patients to consume in that fasting window. My cholesterol has gone up doing keto and ketones. Is that normal? So two things. Yes, it's normal initially for the cholesterol to go up, and then it tends to even out and go down. You also have to check which cholesterol markers you're looking at. If you're looking at total cholesterol and your HDL has gone up, which is our good cholesterol, then that's not necessarily a bad thing because we want the HDL to be high. So you have to take both of those things into account. But then also take a look into how you're following the ketogenic diet. Again, I don't recommend dirty keto. And then looking at the percentage of fats as well. Sometimes I adjust that for patients. We're looking maybe at 50 to 60% fat. So it might be that you have to make some adjustments. So I would probably I would end up tracking your food a little bit just to make sure you're getting the right ratios of your food. Can a ketogenic diet end up creating diabetes or other health issues? So no, absolutely not. A ketogenic diet will not cause diabetes. What causes diabetes is high carbohydrate and sugar consumption. So you will absolutely not give yourself diabetes following a ketogenic diet. It's not possible to do that. A ketogenic diet is actually something, again, that we will use for people to help bring those blood sugar levels down. So you will not give yourself diabetes if you follow a ketogenic diet. and you can absolutely follow the diet long term without concern of other sort of health issues. The one concern with the ketogenic diet is the development of stones, and so usually that's because you're not getting enough minerals. So we always make sure that you're having your electrolytes, your magnesium, and then if you're prone to stones, make sure you're getting your potassium, because that can prevent some of the stone development as well. But other than that, there are no sort of detrimental impacts from long-term, from following the ketogenic long-term. When first starting eating, should I eat from 11 until 6? So with intermittent fasting, it's essentially you want to eat in your 8-hour window. And so I want people to sort of fast for 16 hours. So it really just depends on when you have dinner. So you can, if you want to start your first meal at 11, that's not a problem. So it just depends on when you finish. But generally we want to sort of have that fasting window somewhere between kind of that 11 and 7 mark. We obviously don't want to eat too late in the evening, but again, if you do end up eating late in the evening, that is the benefit of intermittent fasting, is then you just make sure you do your 16-hour fast and extend that time when you start it. So if you end up having a late night, you finish dinner at 9 o'clock, then do 16 hours starting from 9 p.m. Is a ketogenic diet safe for non-alcoholic fatty liver? Yes, absolutely. Fatty liver is, you'll hear a lot of people say, I have fatty liver, I need to stop eating fats. That's actually the reverse. If you have fatty liver, you need to decrease your carbohydrate consumption, not your fat consumption. So for my fatty liver patients, I'm cutting out the carbs and moving them to a higher fat, low carb diet. But again, work with your healthcare provider, make sure that they say that is safe for you. Should I stop taking calcium and vitamin D while rebooting or even for the 24-hour fast? No, definitely not. You can absolutely take your supplements, keep taking your vitamin D, keep taking your calcium, your magnesium, any other supplements you're taking, not a problem. You don't have to stop your supplements during the reboot. And I always encourage making sure you're still taking, your supplements, and especially all of your electrolytes and your minerals. When breaking my fast, loose stools always happen. Is this normal? Yes, it can be. Depends what you're breaking your fast with. I would look into what you're choosing in your fast. It might be you want to choose different foods. I usually encourage sort of higher healthy fat foods, things like avocado and eggs. They're very gentle on your stomach. And so that's usually what I would recommend to start. So it might be that you want to choose a different food when you are breaking your fast. Your thoughts about vegan keto. So really that question more is my thoughts about veganism and vegetarian in general. So you can absolutely do vegan keto or vegetarian keto. I personally do not encourage vegetarianism or veganism. Sorry for any of my vegans here on this call today. I'm not a supporter of vegan or vegetarian diets just in general. Very nutrient deficient. They're usually my most unhealthy patient population. If you are vegan, if you are vegetarian, you absolutely must supplement. It's impossible. Absolutely impossible for you to get all the nutrients you need through diet alone. It ends up being a very high carb, starchy diet to try and feel full and to try and get all your proteins, mixing different grains and beans and starches and things like that. So I'm not usually a fan of vegan keto, but again, I know a lot of people are trend that way for ethical reasons, which I respect and I understand. And so if that's the case for you, it just means you have to be conscious and cautious and aware that you need to be supplementing with other things. You can absolutely be keto. But again, whether you're keto or not, you absolutely need to be taking some additional supplements to make sure you're getting all of your nutrients. Otherwise, if you're not doing that efficiently, you're probably going to be nutrient deficient. Whether you're keto or not, all of my vegan vegetarians need to take protein supplements. And so that would be the case for this as well. You have to get a good protein supplement in there. Make sure you're getting your protein every day. For my vegans and vegetarians who aren't obviously going to use whey or anything like that, my favorite is Sacha Inchi. I don't like soy, but Sacha Inchi is a complete protein and it's plant-based. So that's usually what I recommend for vegans and vegetarians. You absolutely need to supplement to get your protein in. Is it okay to take L-carnitine when you're fasting? Yes, you can take L-carnitine when you're fasting. Can NAT cause kidney stones? So no, generally NAT does not cause kidney stones. I know the concern is often with a ketogenic diet contributing to stones. So I touched on that a little bit earlier, so just rewind a bit. And I'll give you, and there's a little bit of information on that as well, but no, drinking ketones should not contribute to the development of stones. I've been drinking ketones for 2 weeks now, going to 3 weeks, haven't been losing any weight. Why is that? So I love the question about weight loss and exogenous ketones. And it's so important to remember that everyone is coming from a different metabolic space. We all have different amount of fat that we'd like to lose. Our body is doing different things. And so you'll often hear people say like, oh, I lost 20 pounds in a month. Please don't compare yourself to those people. Again, it just depends on what's happening internally. Are you inflamed? Is there gut dysbiosis going on? Is there a hormonal imbalance, a thyroid imbalance? Are you in menopause or andropause? All of those things play a role. Do you have massive stressors? Are you insulin resistant with massively high insulin levels? And all of those things take time to balance. And so as you transition and start to make healthy, sustainable change, you can absolutely bring all those things back into the normal range, but you're not going to lose fat until those things return to normal. So if you have high insulin levels, insulin is a storage hormone. Until that comes back into normal range, you're probably not going to see the fat loss that you're looking for. So there are other things underlying. So I love doing blood work with my patients because even though they're not necessarily seeing the number on the scale change, we see the numbers in the blood work change. And so that's something that I love to do. And so we'll see, look, your insulin went down, your inflammatory markers went down, or a certain values improved. And I love doing that so they can see, oh, something is happening even if I haven't seen the fat loss go, and the fat loss will come. So I never like to do crash diets. What you're doing is the healthy, sustainable way. This is what allows you to keep that weight off long term. So I never give my patients like crash diets and just have them lose a ton of weight all at once. It's just slow and steady, and sustainable is what you're looking for, and healthy. So don't be discouraged. Know that the changes you're making are positive changes. There are things that are happening internally that you can't see, and then the fat loss will come. You can always pair it with fasting. The fasting is also very helpful. To pair this with the intermittent fasting and see if that helps. But again, I would make sure you're working with a functional medicine doctor who's checking all your blood markers so you can see some of those changes as you go through. And you'll see the benefit of what you're doing. I find that's very helpful and motivating. So we're not just using number on a scale as a primary motivating factor and the primary determinant of positive health. How do you pick the correct keto diet? Like what food you can and can't eat. Okay, I've been following dirty keto. I want to go full keto. I don't know which way to go. So that's a really good question. You should probably work with somebody who really understands the ketogenic diet and has a good grasp on your health. There are definitely different ways to engage or to do the ketogenic diet, so you probably want to work with somebody who can help guide you. I don't generally recommend dirty keto, although I will recommend that for somebody who's coming from some really unhealthy food habits, and when going straight keto, we know is just going to be a bit of a stretch. Dirty keto is a good transition into helping to get the carbs out, but still providing that, the satiating foods and things like that. So that is when I allow sort of my patients to do the dirty keto. But generally, I'm wanting my patients to follow keto in a healthy way, anti-inflammatory. I like my patients to be dairy-free when they do it as well. So I take it cow's milk, but goat and sheep are fine. So that's usually what I'm recommending. And then it's not necessarily sort of that 70% fat. I'm usually bringing that down to 50 or 60. Tons of healthy plant-based fats, avocados and olive oils and nuts and things like that. So that's usually what I recommend as sort of as a start. For people who are new and aren't really sure how to get into keto, what I often will recommend is intermittent fasting. And then you've got 2 meals left in the day, and only one of those meals can have a carbohydrate. So that's sort of a slow transition. And then obviously you're just choosing healthy whole foods for the rest of your meals. So that's generally what I recommend. That's generally what I recommend as a start. So hopefully that helps. But yes, there are quite a few ways to do it. And so often it's helpful to work with a provider, get your blood work done, and they can help direct you in terms of what's right for you. So PCOS, what are the benefits of drinking ketones for someone with PCOS? So with PCOS, this is one of I would say one of the more well-studied conditions that a lot of women suffer from with respect to ketogenic diet or beta-hydroxybutyrate. So we know women with PCOS have high insulin levels. They're usually insulin resistant. They have high male sex hormones. They have a lot of anovulatory cycles, irregular cycles. So these are things that are really helpful. Ketogenic diet and exogenous ketones are often quite helpful. And studies have shown beta-hydroxybutyrate can actually encourage ovulation in animal studies and can bring down elevated testosterone levels in women back into normal range. But interestingly, it doesn't lower testosterone. So if you have normal testosterone, male or female, it will not lower your testosterone levels. But if you have elevated in PCOS, it will normalize that level. And then also we know the role that beta-hydroxybutyrate can play on our blood insulin levels. So it can play a role in helping to balance those the insulin resistance that women with PCOS experience, which can also often contribute to weight gain. So there could be some benefit there with respect to fat loss. Will I retain water, drinking that twice a day? No, you shouldn't. Just make sure that you're drinking tons of water, stay hydrated. But no, you shouldn't retain water. I know there's a concern with the sodium. Will the sodium make you retain water? No, again, it shouldn't. I always refer back to the article on the Prove It website called It's Not Salt's Fault. So I would go back to that, reference you back to that to read that article to get a bit more information on sodium. And so that's sort of where I'd start, but just drink tons of water. You shouldn't have, you really shouldn't have any issues with the water retention if you do that. If you can only make it to 14 hours of fasting, does it even help? So yes, it does still help. And so this is it can often be a gradual progression. So I have patients who can only make it 12 hours. And if you can only make it 12 hours, then that's your time. And then it's a slow progression. And then we increase to 13 and then 14. And so sometimes patients will sit at 12 hours for a month or two. And then we start playing around with stretching that window. And so yes, there is absolutely benefit there. So don't be discouraged if you're not quite making it to 16 hours. Just stick with your 14 hours, and then in a few months, try pushing it to 15 and then to 16 and just slowly progress up. I've had some patients, it took them a year to transition into fasting and being able to skip breakfast. Most of us are carb dependent, and so taking out the carbs, fasting can really be challenging for a lot of people. So just make sure that you're, again, doing that slow progression, take it one step at a time, absolutely no problem. Everybody is different, so if 12 hours is as far as you can make it for now, great. And then know that, again, in a few months, or even in 4 weeks, if that works for you, try pushing it a little bit longer. And eventually you will be able to stretch a little bit longer each time until you can get to that 14, 16, even 24-hour mark. So don't be discouraged, you will eventually get there. Will drinking ketones cause hair loss? No, drinking ketones shouldn't cause hair loss. Even the ketogenic diet shouldn't cause hair loss if it's done correctly. And by correctly, I mean to make sure you're consuming the healthy fats. Some people will do keto by just eating, chicken and lettuce. They're low carb and low fat. That's often where we can see some of those hormonal imbalances. So as long as you're getting those healthy fats in, we shouldn't see hair loss or anything like that when you're following a ketogenic diet, and you definitely shouldn't see it when you're drinking your exogenous ketones either. So that is all of our time today, everybody. That absolutely flew by, as always. I will try and go back and answer any questions that I missed. As I mentioned at the beginning of the call, hopefully you're all going to be able to attend the Virtual Keto Academy. Next week, I'll be talking about, my talk is on ketones and the microbiome. So hopefully you'll be able to attend. So thank you for listening, everybody. Enjoy the rest of your week. Stay safe and stay healthy.